You're tuned into Inside Lowell. Inside Lowell podcast brought to you in part by Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank.
WellPoint. Unicare is now WellPoint. New name, same commitment to Massachusetts. At WellPoint, your whole health is their whole point.
Boston North Company, offering a wide variety of business solutions to help restaurant and retail clients save money. Boston North. Mahoney Oil Company, providing warmth and protection to families in Greater Lowell and Southern New Hampshire since 1925. That's Mahoney Oil. Francis E. Preventia Insurance. For auto, home, business, and life, trust the agency Greater Lowell has counted on for more than 40 years. Francis E. Preventia Insurance. GoPuff, a grocery store right at your fingertips. Use the code Lowell20 to receive $20 off your first order of $21, plus free delivery. Download the GoPuff app or visit gopuff.com today. And by the Massachusetts Pirates, bringing all the hard-hitting action and excitement of arena football to the Tsonga Center in Lowell. Get your tickets today by visiting masspiratesfootball.com. And now, time for another Inside Lowell podcast. Inside Lowell. If Lowell is your home, this is your place.
Hello again, everybody, and welcome to another Inside Lowell podcast. I am your host, Teddy Panos, coming to you from the WellPoint Studios here in beautiful, historic downtown Lowell. You may notice a little new decor in a couple of minutes here in the WellPoint Studios, but we're very excited to have our friends at WellPoint partner with us here at Inside Lowell, and actually partner with us a little bit on this podcast. Unicare is now WellPoint. New name, same commitment to you and to Massachusetts. At WellPoint, your whole health is their whole point. And perhaps not so coincidentally, joining us here in our WellPoint studios is the general manager of WellPoint, David Morales. He's the good-looking gentleman off to the left of your phone screen, computer screen, television monitor, however you're watching us. Good morning, David. How are you?
Good morning, Teddy. I'm very blessed. Thank you.
Great to have you here. By the way, I just kind of noticed your suits here are almost matching. Same shade of blue. The city manager, of course, he's got to, dress the part. So he's
got better boots than I. Those are nice wheels.
Yeah, we had about a half-hour boot conversation before we went on.
Boots are coming to Lowell, just to let everybody know that.
Lowell City Manager Tom Golden is joining us as well. Great to have both of you guys here. Want to let folks know that the reason we're having this discussion is because April 3rd, beginning April 3rd and going through May, May 1st is open enrollment for the GIC, and that is the health insurance for municipal employees, state employees, everybody who works for government. It's a big thing for you, Manager Golden, because health insurance is one of the big line items in your budget, right?
That's correct. I mean, health insurance over the years has been about approximately $25 million, and it just continues to go up. David could speak to this at some point later on, but we're typically looking anywhere from a 7. We've had higher, but this year they just announced an 8.5% increase. So that is a definite dollar-driven issue for this for the city as well as every other organization.
So finding ways to try to save, I would imagine, is a big part of what you have to do as manager,
That's
right?
right. I mean, this is one of those conversations. I've known David for quite a few years from the State House, and respect his opinion on all of this. And he's here really talking about what healthcare is, what it isn't, how that people should be looking towards doing a little bit of homework to find out what is the best plan for you, for your family. What are the realities? What happens in your world? What is going to push you to go from one particular health care piece, or the second one or the third one, or so on and so forth. So it's an issue that I think we need to talk a lot more about, especially that open enrollment is literally right around the corner.
And what is your role as a city, as the city manager at a period like this? So you basically present all the different options, and there's WellPoint as an option, but there's all the other biggies, right? That everyone knows, Harvard and Tufts and whatnot. Yep. So you allow your employees, you give them a buffet of options, and they have to pick one, right?
That's right. And
how do you educate them on that?
This is what we're hoping is something like this. We're trying to educate more in regards to what is it that you need. From the city standpoint, the biggest job that I have is to make sure people are happy and they're healthy, right? Make sure they're happy working here in the city of Lowell, and make sure, of course, if you don't have your health, I mean, what else is there? So what does that mean? And when we consistently see the growth rate of health insurance increases, I want to make sure, HR wants to make sure that people are well educated as to what it is they do need and what it is they don't need.
Mm-hmm. And David, your role when working with a municipality, or I guess I should ask, do you work with the municipality, or do you go right to the employees themselves, those who get the coverage under the GIC? How do you work to kind of ensure the benefits of your members, and how do you balance that with what taxpayers who aren't members are looking for, and which is cost savings, right?
Yeah, great question. So first and foremost, WellPoint, formerly 𝐖𝐞𝐥𝐥𝐩𝐨𝐿, is a health plan administrator. We're not a health insurance company. We administer health benefits on behalf of the Group Insurance Commission. In other words, the state, through the Group Insurance Commission, has a contract with WellPoint to administer health benefits. We don't administer dental, vision, or the pharmacy, just a health, medical provider, etc. Our role, frankly, is to essentially make sure that your members, the employees, our members, have access to the medical benefits they need. So, for example, hospitals, doctors, nurses, health centers, our job is to make sure we facilitate the broadest provider network possible available to them. Number two, our job is also to make sure that we negotiate affordable contracts with hospitals and doctors and nurses, et cetera, to be able to bring those benefits to our members. And that's a humongous part of our job. And then finally, our job is to make sure that we stand up clinical services that align with providers, so that members, whenever they're either in a situation where they need medical services or proactively want to manage their health, which is what I prefer, that we have those services available to them. So we've got a range of suite of services for members to access.
Is there a kind of a minimum, a uniform requirement that's required by the state, by municipalities, for what has to be offered? I know in talking to you in the past, and also talking to Dr. Langer during our health minutes, that you guys focus a lot on whole health, mental health. I believe you're like the first provider in the Commonwealth to offer complete mental health coverage, correct? But what are the minimum benefits that everybody who's in this field has to offer, and what can every employee of the government expect if they're insured under the GIC?
Yeah, it's a great question. So the Group Insurance Commission, I won't speak for them, but they typically follow the guidelines that the Division of Insurance promulgates. And the Division of Insurance promulgates essentially what the state lawmakers have passed. Typically, Massachusetts has much richer health benefits than most states in the nation. So the Group Insurance Commission employees enjoy those benefits. They're very robust, very beneficial to them. So we, WellPoint, adhere to what both the Group Insurance Commission and the DOI essentially promulgate vis-a-vis health benefits, which is a very robust suite of services.
From your perspective, Manager Golden, what are the strengths and weaknesses of that? And you also kind of dealt with this as a legislator for 20 some odd years.
But being on this side of it, it's very, very different. Right now, people are saying, "Oh, it's healthcare. I don't want to pay attention to this." This is so vitally important, and that's why I think it's important that David is here, just to talk about the different portions of healthcare, right? Like what is available, what can happen. If you're, for instance, if you're a 24-year-old brand new police officer, a firefighter, a teacher, or whatever the case is, boy, should you be looking like this? What if you're a 53-year-old guy with kids and, that travel or do certain things? What should you be doing here? How can you possibly, once again, stay healthy is the most important thing, but But from the city's perspective, once again, we need happy and healthy employees. If we have that, that's the recipe for success for the municipality. From the state level, when I was a representative, it was kind of more macro. We're looking at it from a macro thing, making sure that all of these health plans or ideas were out there. Now looking at it differently, completely different. I want to make sure that what is available for the city employees is something that's going to help them. And that's kind of where I always pose questions to David, and he probably hates the fact that I have his number. But, what should someone who is retiring be looking to? What should someone who is 20 some odd or 30 some odd be looking to? And I think those are the biggest things. What is healthcare in a very basic form?
And those answers differ depending on where in someone's career they are. As Manager Golden mentioned, the 24-year-old just on the police force or just got hired as a teacher after finishing grad school isn't necessarily looking for the same things as the person who's a year or two away from retirement, or the retiree, which I want to talk about before we end here as well. Right, Dave?
Absolutely. So look, there's a range of options here. I'll only speak about WellPoint. We have 4 products, and if you're an active employee, to Manager Golden's point, let's use that example. 20-year-old police officer just got on the force. If you're single and you don't have a family, you might just want to go through for a lower premium cost product. We have that called Community Choice. Community Choice has the lowest premium products on the GIC shelf. It's a narrow network product, but here's what that really means. It means that your Mass General Brigham facilities are not in network or non-preferred. And so if you go there, you're going to pay a bit more out of pocket. However, if you're just going to stay local and regional, like just visit Leahy Burlington, Lowell General, or local doctors, that's a pretty extremely awesome product for you as a young person who may not go to the doctor often, may not need health services, generally healthy, etc. Now, on the other hand, if you're 50-some employee and you have a family and you have young dependents age 24, 22, 18, and you are looking for a product that's pretty comprehensive, well, you might want to look at Plus. You're going to pay a bit more in premium, over $100 more per month, but it's going to be extremely comprehensive and very beneficial for your family. Now, if you're a bit older and you think you might be traveling and have a lot of significant health needs, you might want to look at Total Choice. You're going to pay a lot more, but that is a very comprehensive indemnity product, meaning you can go anywhere in the world and we will cover you.
Okay. It was interesting, though, you mentioned your Community Choice, which is your most affordable product, but the hospitals you mentioned, not just here, when we hyper-focus on Lowell, but the surrounding communities. So Lowell General, part of Tufts Medicine, is the hospital that serves most folks, but you mentioned Leahy.
That's correct.
In Burlington. So that is in the network for Community Choice as well?
That's correct.
Because that's, not, and no disparaging any other hospitals, but Leahy has a very strong reputation. And
yes.
Well, people love their doctor. Well, they love their doctor and they love their hospital, right? So whichever one that happens to be, I consistently hear, I go to Lowell General or I go to Burlington Leahy. And that's kind of the 2 places where they go. And if there's an ability for us to save money for the employee, they're happy, they're healthy, this is kind of what the discussion's really about.
But I remember, because when I kind of went through this process many moons ago, though, you look at, when they talk about network and okay, I see my doctor in there, I'm good. But not realizing, eventually as you get older, as I have, you start to require to see certain specialists. And suddenly you realize, when my doctor has to refer me to one of them, they're not covered in my network. And that's where it starts to get really, I think people really need to make informed decisions, right?
Absolutely. And that was, again, part of Manager Golden's point earlier is do your homework. Right, as an employee, your job is to do your homework. I believe in self-empowerment and personal responsibility. So check out the products, check out the offerings. Let's talk about what you just said, right? I need a specialist now. If you are in a Community Choice product for WellPoint, you're enjoying a very competitively priced premium, like the lowest premium. You're saving yourself some real good money on your paycheck. But now you might need some specialists. The question is, are those specialists part of our network at Community Choice at a lower cost? The answer typically is going to be yes. But if they're Mass General Brigham facility providers, be careful. It's going to cost you. It might cost you some out of pocket. However, if those clinical services you need, okay, are not covered by any other provider inside the Community Choice Network, then we will honor that at a lower cost. So that's an important data, and that's why you have to do your homework. There's a way to do two things here. A, have awesome coverage, but also save yourself some money.
Do your guys' roles ever like conflict? I would imagine you as the city manager of municipality who has to pay. What percentage do you pay of the healthcare?
Yeah, 25/75. Right.
Okay. You would love everybody to be on the lower end product for whoever they choose, right? Community choice in this end.
From that perspective, from a financial standpoint, of course, yes. But once again, it depends on what works for you. I mean, if you find yourself specifically, I go to Lowell General Hospital and I go to Bill Ricker, Burlington, down in Leahy. Now you start to say to yourself, why do I want to pay the extra money? Now, if you go to Children's Hospital or something to that effect, if something's going on and you need to go to Children's, maybe that's a different piece. That's and once again, you can do this every year. This is there's no health plans. And once again, I'm talking to an expert here compared to my knowledge. You can always move over during the next open enrollment if you find yourself utilizing a service that's not there to go to a different tier. Is that, because whole health is something I also want to talk about.
Yeah.
What exactly is whole health? How do we do this? But from the manager's standpoint, from the way I see it, and I know that we've been talking to my CFO about this stuff, first and foremost, we want to make sure that all of our employees have the choice that they need. What is going to work for their family? But far too many times we just find people just doing what I do, or what you do, or what David said he should do. And people just kind of follow along and go into sometimes what is much more expensive plans, which is wonderful. But if you're not utilizing the remainder of the benefit, we're trying to save our employees money as well.
From your perspective, Dave, does it really matter which option your members select?
For us, it doesn't matter, frankly. I mean, part of the reason why I describe this as an administrative service company, the state's really a financial risk. Now, we get paid a fee to administer these benefits. Our significant part of our job is to make sure that we're negotiating lower price contracts with hospitals and doctors. So let me talk about that a little bit because it impacts the city and the state. So at a high level, what drives healthcare costs and premiums? It's the provider's price times the utilization, times the number of times you use it, right? That's healthcare cost. It's no secret. In Massachusetts, what's interesting is almost 90% of the premium is provider prices times utilization. In Massachusetts, almost 90% of healthcare cost is provider prices times utilization, right? Not administrative cost, right? It's almost 90%. So where you go for care is truly important. If you go to a Mass General Brigham or a higher price facility, those prices are really high. That development, right, that cost, the utilization is going to factor into the premium, the next year's premium. So as an employer, if I were Manager Golden, not to speak for him, I would be thinking, where are my employees going for care, number one? Are they staying regional, right? Burlington, Leahy, Tufts Medicine, Lowell, or are they going to Boston? The more they go to Boston, the higher the price, right? And number two, do they have the choices available to them and the information necessary to make an informed decision? And so that's where we come in. We educate. We have transitioned now more and more toward WellPoint, toward a whole health model to try to get members engaged in their health experience so that they're using hospital high-cost services less and taking an active investment in their health.
Man, you took me right where I wanted to go. A perfect segue. So, because we're coming up on that period, April 3rd is the time frame where folks are going to make any changes that they're going to make. What do you offer in terms of education for people who are going to go there? They're going to look at the 5 or 6 different providers who they can choose from the city of Lowell, and then they'll say they focus in on WellPoint, and they see, okay, well, there's 4 options there. How are they able to reach out to you, and what kind of information are you able to provide for them at that point to help guide them into choosing the right plan?
Sure. So I'd say there's 3 players here. There's a Group Insurance Commission, there's WellPoint, then there's a city. The Group Insurance Commission does a really good job at offering a ton of information to employees. the HR coordinators that manage Golden overseas, and working with us to get that information out. At our level, we have an incredibly robust website. We have a one-page benefit outline on our website. You can download it as a PDF to understand what we offer. And then number 3, we do a lot on social media to educate employees on LinkedIn, on Facebook, et cetera, about our benefits. We have 3 key things we remind people about. We're an indemnity plan, meaning our members can go anywhere, we'll cover them. Number 2, you don't need a referral. We empower you on a health journey to stay healthy, nor feel necessary. And number 3, you don't need a primary care to choose a primary care. We encourage you to do it, but you don't need to, because part of our mantra is you are in control of your health, and we want to support your health journey toward a whole health model. But there's a third party here. There's HR coordinators with the city manager that do a good job also getting that information out.
And that's exactly what we're trying to do. I mean, this is the start of this today. We may be looking to do something just within, say, City Hall. We may be looking for local partners that also have the same type of healthcare, whether it be the university or Middlesex Community College, because we're all offered the same 3 major companies, right? I believe in this area. Four major companies.
Well, 3 in you're right. Sorry, 3 in your area. That's correct.
So there's 3 major companies that offer health insurance, and then within those companies there is 1, 2, 3, 4 different tiers or platforms, or what fits you. So there's a lot going on here. There's a lot to kind of pay attention to, and this, potentially there's a lot of savings for, once again, the employee, to make sure that they're happy and healthy. That's really the goal here. If you're not utilizing all the bells and whistles, why would you take it? If you're really finding yourself within this area, but if you're on, say, the first tier, which is Commonwealth care.
Total choice.
Total choice.
Expensive, yeah.
The least expensive is total choice.
Oh, the least expensive is community choice.
Community choice, sorry.
Yes,
sorry.
the least
Even I've been reading this stuff and I'm getting my... So,
Which one do you have?
well, I'll tell you
Do you
what.
even know? Should I talk to the wife?
Talk to Joan
She knows
about
what
this,
you have, right?
As a pharmacist, she's like, this is what we're doing. I'm like, okay, whatever you want to know, But so from community choice standpoint, one of the questions I consistently hear all the time, well, I go to Florida once a year or whatever. What happens? Yeah. What happens to me there? Yeah. What's gonna go on? And I'd let David answer that as far as if you're out of network or how that works with an indemnity type program.
No, that's a great question. So we have, the GIC does a really good job of asking their carriers to cover you if you travel. We take it to a different level, right? Part of us is our service. So wherever you are in the world, let me step back a little bit. UniCare is the only plan that can cover a GIC member who's going to live full-time outside of the United States. So if you're going to live outside of the United States in France or Germany, UniCare, WellPoint's WellPoint's your choice. The second part that we do is service. We try to engage our members to make sure we know where you are. If you're going to go on vacation to Aruba, for example, and you let us know, we're ready for you. If something happens, we're going to engage immediately to make sure that the doctor or the hospitals can take care of you, or that we get you out of there to a hospital near the United States to take care of you. So we're very proactive with the members to make sure that we're servicing you wherever you are. I take credit. I take some big pride for that. Our team, I take no credit for it. My team's awesome. The team is exceptional. Customer service, clinical nurses that connect with our team members at all times to make sure we know where you are.
We're chatting with David Morales to the left of your screen here. David is the general manager of WellPoint. UniCare is now WellPoint, and as we like to say, new name, but same commitment to its members and to Massachusetts. We're glad to have David here. Lowell City Manager Tom Golden, who you should recognize by now if you're a loyal InsideLowell follower, is joining us as well. We're chatting with him because April 3rd, less than a month from the day that we're recording this, is when the open enrollment begins for the state's GIC, those covered under the state GIC insurance plan, of which WellPoint is one of the providers. You mentioned whole health, and that's something you want to start focusing on with your employees. So why is it important to you?
It just really goes back to the same mantra. If people are happy and they're healthy, that's what we care about. I mean, I know last summer and fall, we started, yoga in the park and stretching in the park and things like that, just because we're trying to bring not just the city employees, but the community together. There's really been a big push, I think, in the healthcare, and David could speak to this, that, at 53 years old, growing up, you never saw the doctor unless something was absolutely wrong. Well, today, what we're trying to do is encourage people to become more healthy or create healthier habits. And if that means on a Saturday or a Sunday, which we're going to bring back as soon as this weather breaks, we're going to bring it back into the parks. Just an opportunity that, hey, maybe I don't know anything about yoga. Maybe I don't know anything about stretching. Maybe I just want to watch and learn. We had a lot of people participating in our local parks when we paid someone to sit there and kind of just tell you what to do. And even if you stuck around for a while, you had a healthy snack afterwards. We started to get people really, really interested in it. And it's the whole point of whole health or helping the individual get into a better situation for themselves.
And you mentioned holding information sessions, perhaps at City Hall.
That's right.
Do you kind of take it to where your different classes of employees are? Obviously, you have employees at City Hall, but you have police department employees, you have fire employees, you have an entire
we have a lot of campuses.
Do you try to kind of reach out to all those different locations and set something up for them as well?
We definitely will be, but we have a lot of different campuses for the city, so it's always a challenge. I mean, with the number of schools, I don't think any of the organizations under GIC would have the people power to get into all of our school systems because there's so many of them. But we're going to try to keep it as helpful as possible because the health tools that I think that one-on-one, which has been provided, I think that's the most important and people feel comfortable. But then again, the health tools that you have online are everybody has a phone, right? Everyone has a phone, but trying to get over I guess there's a stigma there that health insurance is difficult because it is a challenge. Yeah. It's a challenge. But from what I have seen thus far, breaking it down, they've been doing a really good job at this. If you're doing this, then that. It's really getting a little bit better, but you have to devote a little bit of time to it. And if there is a financial component to it and you're still receiving the same health care and your family's happy, healthy, and everyone's moving in that direction, there's a lot of education that needs to continue to happen.
Technology has changed the playing field significantly. There was a point where I was actually insured under the GIC through my first wife, and honestly, I didn't know what the hell was going on. I didn't get. But now I know you guys are WellPoint. You're phenomenal about the phone apps, the different services that you've taken to your members. Yes. How important is that, and how much a part of the future is that? As the manager said, being able to look things up on your phone in terms of answering health questions, telehealth, et cetera.
It's crucial. Look, over 80% of our health is driven by external factors outside of the hospital or the doctor. Over 80%, right? And so part of what we've been doing for the past couple of years is setting ourselves up to support our members outside of the hospital or the doctor's office. So one, using technology. We have an app called Sydney Health. It's, to me, the best thing I've seen in the market. You can chat with us real time. You can send us a text message. You can talk to your doctors, your clinicians, Live Health Online. If you want to do a teleconsult, all in the power of your phone, right? Yep. We want to get better at servicing people where they are. For too long, we were taught that our health to manage your Golden's point is, hey, you get sick, you go to the doctor or hospital, whatever. We're trying to change it to say, no. Look, stay ahead of it. Stay active. Eat better. Exercise, walk, whatever you can do, run. And then second, we're leveraging technology to also understand the behavior of our members, right? Wherever they are in their health journey, we want to put, for example, if you have somebody who's really highly acute ill, we're going to have a nurse that's going to connect with you, right? And if you don't want to talk to the nurse, that's fine. But we're going to proactively come to you and say, hey, look, we want to help. If you're very healthy, we're going to keep pinging you with the Sydney app to say, hey, look, we're here. If you need anything, how about dietary issues? You want some help with the diet? So we're trying to get active, proactively active with our members to make sure we enable them their health journey.
Yeah, because as I've learned through talking to you, but also during the health minutes, the best way to save money on healthcare is to not get sick. Don't stay healthy. And it's amazing how much money you actually save. And nowadays, you hear the horror stories of the emergency rooms and the long waits there. I imagine being able to reach out to somebody on a phone through an app, the Sydney app called it.
Sydney.
Boy, I wish I had known that when I took my father to the emergency room and waited 11 hours a few months ago.
That's one of the things. I mean, people sometimes go in there because they're panicking, but if you have the comfort of the phone saying, hey, this is what's happening to me. What do you think? What should we do? Well, something everybody knows that this thing has been going on. You're presenting all the same symptoms. This is what we believe it to be. So, because the healthcare experts, really. Like your wife, she could probably, being a nurse, she could probably diagnose something on the phone. This is how I feel. This is what's going on. You should take this, take that, over the counter or whatever the case may be, and you're going to feel better. You're going to ride it out. Why? Because she has seen this. It's no secret. Whenever there's a stomach bug or a flu, everybody seems to know about it at the same time. Everybody seems to get it at the same time. That sounds like that flu that's going around. This is what you should be doing.
But yeah, I see it
as opposed to being in the emergency.
Right, I see it up close with my wife sometimes doing telehealth things or talking to her patients or their family members if it's an elderly person on the phone, but also, doing things like managing my father's, blood pressure medications whenever there's any changes and stuff. We're moving more and more towards that model. Before we wrap up, I want to talk about retirees, because I heard you guys mention it at some point earlier in the discussion, and I just assumed everybody who's retired, whether they work for government or not, is on Medicare.
No,
they're not.
No, they're so. In order to qualify for Medicare, you have to be typically 65 years old. There's a certain cohort in the Massachusetts Group Insurance Commission that worked in state government prior to 2000 something, I forget the specific date, but that did not get enough credits to earn Medicare eligibility. Roughly 10,000 people or so. And so those folks are either in WellPoint or another one of the GIC carriers. Those folks, the ones that we service, are typically in total choice. But for other retirees that do have Medicare as a primary coverage, in other words, either Part A, Part D, or Medicare Advantage, we encourage them to look at WellPoint OME, the Medicare supplement product. Our supplement product is actually the largest. We have about 90% of the state's retirees are in the Medicare OME sub product with WellPoint Unicare.
Wow. 90% of the retirees.
We have the majority.
I remember from a prior conversation, you got about 55% of the active workforce, right?
Correct. Rough. Yeah. Yep.
So that tells me you're doing something right.
Look, I take no credit here. We have a good product. I think the GIC does a great job, and we have a great team. I'm very proud of the team we have at Unicare. We have customer service reps who live in the state, who are your neighbors. They care for you. We have nurses that are just awesome. They're highly efficient. They're conscious about our members. They follow up. And then we have an operational team that lives and breathes, how do we support state employees? The way that our philosophy is, state employees serve us, we're going to serve you. And that's how we think about it. Municipal, city employees, state employees, they work, they service us. They drive buses, they drive trains, they take care of the roads, they're teachers, they're police, fire. Well, we need to serve them. Yeah. That's our philosophy.
How about from your end, Manager Golden, the retirees? You sometimes hear complaints from retirees that, hey, nobody thought about us when they negotiated these new contracts and new agreements. How do you handle the retiree issue versus the active employee issue?
Well, once again, it's giving people choice, right? And making sure that, and it's not something that David did or I did or the GIC decided just recently, the 8.5%. And money is finite. Are you in the right product? That's kind of, once again, giving everybody choice, making sure that they know what the choices are, making sure that they fully understand the choices. Quite frankly, I lean on my wife personally a lot because she's in the healthcare field. So she understands the lingo a lot better. I'm starting to kind of eat it through drink it through a fire hose, I suppose. Just making sure that the employees as well as the retirees have all the information they need to make the right decision for their situation, their family, or whatever the case is. And having someone like David here that just has that opportunity to speak to a much, much higher level on this, as well as, I hate to say this, but more plainly. Because sometimes people, if they're still watching, hopefully they learned a little bit more about what's going on in healthcare that they should be dialing in right now, just to make sure if somebody in a retiree situation could save money, or somebody as a current city employee could say, maybe I should try to save that 100, 150, whatever, coming from which point to the other, or maybe because I've been spending it, maybe I do need to, go up a tier.
Yeah.
It really depends. It's about information.
The retirees are probably in a catch-22 in this, right? Because the natural inclination is, especially when you're retired right now, my income is fixed.
Right.
I should look at saving money. And yet, if anyone's going to access healthcare and need healthcare more, the older you get, as I'm learning, you tend to need it more. So it's really a catch-22.
But you're always staying local too.
Yeah.
You're staying local. I mean,
the GIC did a really nice job. So the 8.5% was the average increase.
Right.
Retirees got like 3 to 4%.
4%.
Yeah, something like that. Several things here, guys. The first one is this. Look, we have to understand as consumers, we have to understand that our actions have consequences. If we go to a higher price hospital or doctor's office that costs more money, that's going to have an impact on your future premiums. So to the manager's point, get conscious about, wait, where am I going for care? If I'm going to go to Leahy Burlington or Lowell General, it's going to be a lower cost over time. If all of us do that, right?
Mm-hmm.
Our premium development, our costs will be lower the next year over time. That's typically how insurance works. The second thing is we have to take care of ourselves, right? Our health. And so I use my brothers as an example. Love my brothers, right? Is their diet the best? No. You got to eat better. You got to exercise. You got to walk. And then number 3, we have to understand that in Massachusetts, our benefits here, health benefits, are really robust. Like we have everything in our products. And so that already is expensive. So the more we can think consciously about our health, but our cost, if I'm younger, I'm going to buy a lower premium product,
Right,
like community choice.
Yeah.
We got to think about it.
And that's one of the things, I look at it from, my own personal piece. You have to look at this as personal, not what Teddy does, not what Dave does, not what Tommy does. But I am up a tier simply because we do utilize a Boston hospital that wouldn't be on the initial tier. But if people are sitting there thinking, David, and once again, if you're really, I know so many people that use LGH, use Burlington, and it's all going to be in, that could save you money, from that perspective. Yeah. And that's really reminding people what the choices are and not to follow what Teddy does or, my mom and dad told me to do this one. That's one of the famous ones I hear. And I'm like,
and look, I'm going to work against myself here, guys, but shop around.
Sure.
Shop around, do your homework, right?
And we will be doing, we have to do that.
Around.
David knows that. Yep. We're going to have to bring all of the organizations from GIC in and around just to make sure that it is right for you, because what's right at WellPoint, maybe somebody has a different product that might work for you in another organization.
Exactly. Mm-hmm. Shop around. I encourage it. Shop around. I'm convinced and confident that WellPoint's the best in the GIC, but folks should shop around. Whatever's best for you, go after it.
Any final points before we say goodbye that you want to leave our audience with?
Very simple. Look, get educated and take the time to learn about the products. From my perspective, and again, I'm biased, I believe that WellPoint's the best. We have the broadest network. We're an indemnity model with no referrals necessary, and we have the best customer service team in the state. So you need our help. We're there for you.
From your end?
From my perspective, it is make sure that, if you're seeing this now, start that education, because it's so vitally important, and it's not as hard as you think it is. All of the organizations, and the GIC has done a fabulous job with really starting to break it down. But, where you've been in the last 12 months, 24 months. We're all creatures of habit. We know where we go, right? And the fact that if you're paying you're in a different product and you can save some money, well, that's what we're trying to push from the HR office, and we will be pushing over the next few weeks.
And most importantly, stay healthy. That's the best way to avoid healthcare costs. Yep. David Morales, GM of WellPoint. 𝐞𝐥𝐥𝐩𝐨𝐿 is now WellPoint. Thank you for joining us. Lowell City Manager Tom Golden.
Thank you very much, Teddy, for always bringing us in.
We'll have to bring you back in a couple of weeks because talk about your budget.
We have budgets going on. We got plenty to talk about. We could be on here on a weekly basis, but So.
All righty. Thank you, guys, and thank all of you for joining us here in the WellPoint studios and for joining us here on another Inside Lowell podcast. Hope you learned a thing or two here, especially if you're one of those municipal employees, whether it's in Lowell or any of the surrounding communities, about your health insurance and your options. Till next time, stay safe, everybody.